Welcome to the Foresight Health Roundup podcast, Foresight Health's podcast series for healthcare revolutionaries. Outcomes matter, customers count, and value rules. Hello again, everyone. This is Dave Burda, news editor at Foresight Health. It is Thursday, December 5th. One of the best things about doing this podcast every week is you never have to look far for a great topic to discuss. Last week, when we were pretending to work, but really getting ready or traveling for Thanksgiving, the Biden White House proposed that Medicare and Medicaid cover GLP-1 drugs to treat obesity. Maybe you read the news after eating a big Thanksgiving dinner and thought, hey, I could use a shot of that right now. Now that we've had time to digest the big dinner and the big news, we're going to talk about the proposal with Dave Johnson, founder and CEO of Foresight Health, and Julie Murchinson, partner at Transformation Capital. Hi, Dave. Hi, Julie. How are you two doing this morning? Dave?
Well, I got to say, Dave, the pun police are out looking for you. I'm getting indigestion just thinking about today's topic.
Yeah, it was fun writing the script like I was writing for an 8-year-old, so no offense. Hope you get a chuckle out of it. Thanks, Dave. Julie, how are you?
I'm well. We started a new Thanksgiving tradition. Last year and this year, we took my son to the CVS Minute Clinic because he was on his third cold and terrible cough. And I got to say, the Minute Clinic is a great Thanksgiving treat.
Oh, okay.
Yeah, you should check it out.
A new tradition, yeah. Now, before we talk about Medicare and Medicaid covering GLP-1s, let's talk about your Thanksgiving dinner. Dave, did you avoid gizzards, and are there any leftovers still in your fridge?
Thanksgiving already seems like a dream to me now. But anyway, no leftovers in our house. We went to Shaw's Crab House and Oyster Bar, a great and historic Chicago institution, for Thanksgiving dinner. And we weren't the only ones. Man, the place was jammed.
Mm-hmm. Seafood on Thanksgiving. Love it. Thanks, Dave. Julie, did you binge on yams? And are there any leftovers in your fridge?
Well, we had a little tragedy because where my mom lives, they cater Thanksgiving and they didn't have any yams. So I was disappointed.
Oh.
And whoever was in charge decided that apple pie was the only pie to be served. And I was outraged. So my family and I proceeded to make our way through 4 pumpkin pies for the rest of the weekend.
That's how that works. Definitely. Thanks, Julie. For me, the cranberries were gone the next day, and we finished the last of the mashed potatoes yesterday at breakfast. We like to fry them up, and there is no trace of any Thanksgiving food in our fridge. But, of course, we made a turkey this week because it was on sale, right? So it goes. Follow the incentives. Now let's talk about this benefits proposal from the White House and HHS. Is it a turkey? And there's your transition. On Tuesday, November 26th, the White House and HHS proposed a new rule that would expand Medicare and Medicaid coverage of GLP-1 prescription drugs. Currently, the 2 government health insurance programs cover GLP-1s to treat diabetes. Under the proposal, the 2 programs would cover them to treat obesity. The White House said the expanded coverage would help 4 million Medicaid recipients and 3.4 million Medicare beneficiaries who struggle with obesity. And it would lower their out-of-pocket costs for the drugs by as much as 95%. The White House also said GLP-1s would be part of HHS's next round of Medicare Part D prescription drug price negotiations with drug manufacturers. Dave, do you support or oppose the plan? Who wins and who loses if the proposal takes effect? And what do you think will happen to the plan under the next administration?
Well, before we talk about any of that, fried mashed potatoes, I've never heard of such a thing.
Oh, well, I'll make them for you sometime.
Sounds delicious.
Mold them into patties, throw it in a frying pan, crisp them up. Better than hash browns.
Well, anyway, these are small questions you're asking, but let's go first to winners and losers. There are 4 Ps in healthcare: providers, payers, pharma, and patients. Makes for delicious politics, by the way, so the fun police are coming for me now as well. But if you think about the 4 Ps, pharma and patients want expansive coverage of GLP-1. Providers and payers are scared to death about the cost. Another aspect of this is brilliant politics by the Biden administration and a real hot potato for the Republicans in the incoming Trump administration. They won't be able to avoid addressing this proposal. So, sit back and enjoy the politics on this one. For me, the most interesting aspect of the Biden administration's proposal is how they get around the current prohibition against the government funding of weight loss drugs. They do it by defining obesity as a disease and the need for GLP-1s to treat obesity, as a disease and the related chronic conditions that it causes. This gets to the question now of whether I support the policy prescription or not. I believe, like rock and roll, GLP-1s are here to stay. We're just beginning to realize their potential for treating addictive behaviors like overeating. So many applications in the pipeline. So can I support this or not? In Michigan, where we spend a lot of time, they use the phrase go big or go home all the time to talk about the rivalry between Michigan and Michigan State. I'm not really sure why, but they do it. So I think the answer here is drawing on the go big or go home is that you can't consider GLP-1s in isolation. Their provision needs to be part of a much bigger and broader policy discussion regarding how American society achieves better balance between prevention and treatment, essentially between health and healthcare. And it's impossible to have that bigger discussion without incorporating topics that historically have been off the table: processed foods, lifestyle behaviors, and dramatically expanded primary care coverage. Despite Donald Trump's penchant for eating McDonald's hamburgers, I think his administration is going to go big here on payment and policy reform. So I can see a path where they pay for GLP-1s as part of a much bigger Make America Healthy Again program. Just going to be interesting to see how that plays out. One other aspect of the politics of this is, what are the food companies going to do? The cover story in the New York Times Magazine a couple of weeks ago talked about how there were fewer new, I'm going to call them junk food, processed food products coming out last year. And it's partly because the GLP-1 drugs are fundamentally changing the taste buds of people who use them, and they're going to the produce aisle instead of the processed food section of the grocery store. So the food companies should trying to figure out how to respond to this as well. Anyway, whole new ball game. Let's go big.
No, good analysis, Dave. I did read this week that GLP-1s caused people to lose their taste for alcoholic beverages. So throw in beverage companies in with the food companies.
Wow. Yeah.
Yeah, that's saying something.
I won't be GLP-1ing.
That'll be a tough choice, yeah.
It's really interesting because these are all forms of addictive behaviors, right? And if the GLP-1 drugs can keep you from overeating and eating bad foods, they can also influence, your taste for alcohol, gambling, other addictive behaviors. I've gotten a little bit addicted to Sudoku. Maybe they could help me play a little bit less of that.
Keeping the mind sharp. That's great. Thanks, Dave. Julie, any questions for Dave?
Dave, our friends at the Kaiser Family Foundation said that only half the states that don't currently cover obesity drugs were considering it, and obviously cost being the biggest barrier. So given, mounting state budget pressures, do you think it helps the case for the feds to include the compounders into this, which of course pharma would hate because they just want their brand drugs in there?
As I think about this, Econ 101 just keeps flooding back into my brain. Where there's massive market demand, the market finds solutions. And I can't imagine that we won't accommodate any and all solutions to meeting this massive demand for GLP-1 drugs, including this current wrinkle that allows for the compounding of the drugs that gets around patent formulas, in part because there isn't enough supply to meet the demand. And then, like happened with the Hep C drugs, where the first iterations that came out were just outrageously expensive, as more and more of the Hep C drugs came into the marketplace, the prices come down dramatically. So I think this is kind of microeconomics 101, where you got supply and demand on the X and Y axis. and you get to a clearing price that works for the market. And I just don't think the market's going to be able to resist this massive demand that the American public has for these drugs.
Yeah. There may not be a choice in the market. Thanks, Dave. Julie, you're up. Do you support or oppose the plan? Who wins and who loses if it takes effect? And what's the plan's fate under Trump, RFK Jr., and Dr. Oz, the holy trinity of health?
Well, listen, I support this at the right price and with wraparound services beyond just physicians writing scripts. Like all these virtual coaching services, Amada, Hims and Hers, Rose, they could turn this investment into sustained results and honestly, lifelong behavior change. Because I believe in these drugs, but I also believe that they can and will be massively abused if we don't harness their power for good. So otherwise, why would we cover them? And just to add to Dave's list, these digital health players will definitely be the winners as well if anything like this goes through. And Dave, I don't know if you mentioned the losers in doctors and hospitals ultimately. I mean, this definitely has an impact downstream on our entire healthcare infrastructure. And, for what I think will actually happen, I couldn't help but do a little investigative reporting. Burda, I think you're rubbing off on me. And I did my best to fly above politics, which is hard. And all I can say is pass the popcorn. Dave, I'm with you. This is going to be a good show because this clash between RFK, who is not at all down with GLP-1s, and Dr. Oz, who has extolled the transformational results on his show, if they're confirmed, it's going to be wild because RFK, who, by the way, incidentally, will oversee CMS in his HHS role if he's confirmed, right? So he's been super outspoken, criticizing Ozempic and saying they're counting on selling it to Americans because we're so stupid and so addicted to drugs. Good quote. And, he's emphasizing things like healthy eating and fitness and other, federal-led efforts to fight obesity. And, I hate to say it, RFK, but none of that has worked so well. And, it's inherently biased towards obesity. So it relies on things that I think, won't work, like massive food policy shifts, which of course he's trying to do. Dr. Oz, on the other hand, and this is pretty salacious, he has a pretty sordid history with GLP-1s. Oz promoted Ozempic on an episode of his show sponsored by Novo Nordisk. Novo also was a marketing client of ShareCare, which was a company that was co-founded by Dr. Oz and Oprah, by the way. Oz continued promoting weight loss drugs on his website, where he not only touted the benefits of Ozempic and Wegovy and others, but he also marketed a collagen supplement to combat the sagging facial skin known as Ozempic face. So maybe collagen will be covered next. Love it. Novo acknowledged sponsoring Oz's show, but says that it does not have an ongoing relationship with Oz or ShareCare. And Oz refused to answer questions that were sent to the Trump transition team on his business relationship with Novo and ShareCare. So interesting. Now, of course, if Oz in particular is confirmed, he's going to have to divest any commercial ties to any of the entities anyway. But the concern is that he's about to take over two of the largest taxpayer-funded programs, just as pharmaceutical companies are lobbying their lights out to get these drugs covered. So, again, pass the popcorn. So what's going to happen? As you said, Dave, the Biden administration is going to take all the credit for any progress here, because let's face it, there's strong evidence of effectiveness of these drugs. And not paying for the drugs creates an equity issue, and physicians are out there saying that obesity should be treated just like any other disease. However, we don't have any studies on the long-term effects, so there could be some massive downstream liability that the Trump administration just rubber stamps this, but I'm not so sure anyone really cares about science anyway. And price has, really been the major issue. It's been a stumbling block for Congress. People like Bernie Sanders seem supportive, but not at the current price point, which he claims is 10 to 15% what Europe and other countries are paying. But Scott Gottlieb, who used to run the FDA, noted that price will potentially be less of an issue as Medicare will negotiate the price of drugs like this. That's on the table. And apparently, CMS officials have told advocacy groups that they don't believe the agency could change coverage policy on its own. So, Oz wouldn't really be in the position to drive this through, single-handedly if he wanted to. So I don't expect there to be, immediate action when Trump takes over. But I agree with Dave that this is going to create a discourse that hurdles us a lot closer to the reality here.
Wow. I'm just looking into my crystal ball. Is somebody going to call me Ozempic face when I'm older, right?
Has a ring to it.
It does kind of. Thanks, Julie. That was great. Dave, any questions for Julie?
Julie, by referencing RFK Jr. and Dr. Oz, Burda got you right into the middle of the politics of the GLP-1 debate.
That's right.
Drugs versus lifestyle modification. Another potential wrinkle is the monumental near-term cost of adding these drugs to Medicare and Medicaid coverage against the desire of Elon Musk and his partner in crime, Vikram Ramaswamy, and their Department of Government Efficiency to slash federal spending. What does your astute political radar tell you? And how will the politics of this GLP-1 proposal play out?
Such a loaded question. Quite unfair, Dave. But, early read of the government slashing would tell me that they want to slash people. They want to slash process. I don't get the sense that, something like this would be the first thing that they would want to slash, because it actually can really generate quite a strong commercial opportunity, right?
Mm-hmm.
They're more focused on the cost centers of the government, not the revenue generators for the country. So that's a very simplistic answer, but that's what I got.
So go big or go home, I guess.
Well, I'll have to have the large popcorn, but hold the butter. So I'll respond as a reporter. I'd want to know whether Trump takes GLP-1s. He looks like he lost some weight lately. I'd want to know if Dr. Oz ever prescribed them to any of his patients for diabetes or weight loss. And Julie, it sounds like he probably has. And I'd want to know what prescription drugs RFK Jr.'s on. Hypocrisy doesn't make good health policy. Now let's talk about other big healthcare news that happened this past week. It wasn't all bad, was it? Julie, what else happened that we should know about?
Well, I saw this weekend that both cucumbers and eggs recalled in massive numbers for potential salmonella. And today, I woke up to California halting the sale of Raw Farms raw milk over bird flu concerns. So what is happening with our food production exactly?
Good luck. Buyer beware. Dave, what other news is worth mentioning?
Well, I'm always looking for fault lines as these massive macroeconomic trends like demographics and chronic disease and costs push down on this United States massive healthcare system. Well, here's one. At the end of October, Point32 Health, which is the owner of Tufts Health Plan and Harvard Pilgrim Health, told families of 9,400 patients at Children's Hospital in Boston and 17,000 patients at UMass Memorial Health that the insurer was unable to negotiate a new contract for them. So they have to find alternatives. And the alternatives in terms of a monthly cost are roughly double. So if you want your child to get their care at Children's and or UMass Memorial, you're looking at a doubling of the healthcare premium. This is one of these fault lines between cost and coverage that we're wrestling with. And we're starting to see how different players within the ecosystem are beginning to break. And in this case, it's a payer that is saying no to exceptionally high coverage costs at these prominent children's hospitals.
And you do have to have a high level of consumer health literacy to understand your choices too, right? Because a lot of people will miss that paperwork and end up paying exorbitantly higher prices. Interesting. Thanks, Dave, and thanks, Julie. That is all the time we have for today. If you'd like to learn more about the topics we discussed on today's show, please visit our website at foresightshealth.com. You also can subscribe to the Roundup on Spotify, Apple Podcasts, YouTube, or wherever you listen to your favorite podcasts. Don't miss another segment of the best 20 minutes in healthcare. Thanks for listening. I'm Dave Burda for Foresight Health.